We often think of sexual and urological health as something we only talk about when there's a problem, when pain, discomfort, or embarrassment finally push us to speak up. But what if I told you that understanding your body isn't just about fixing issues, it's about building confidence, connection, and self-love? Hi, I'm Dr. Rena Malik, a urologist and educator who's passionate about helping people understand their bodies and reclaim control over their sexual and urinary health. And today I want to help you see that your body, male or female, deserves care, curiosity, and compassion. Or when we talk about sexual and urological health, most people instantly think it's only about reproductive organs or physical performance. But it's so much more than that. It's about how you feel in your body, how you connect with your partner, and how you nurture your overall well-being. Because whether you're male or female, your urinary and sexual systems don't function in isolation. They reflect everything: your habits, your hormones, your emotions, your stress levels, and even your sense of self. Sure, the first thing I want you to understand is that your body is incredibly intelligent. It communicates constantly, giving you signals that something needs attention long before it becomes a major issue. When you notice changes, a difference in desire, discomfort during intimacy, changes in urination, or hormonal shifts, those aren't random. They're messages. But most of us have been taught to ignore them. We brush them off, feel embarrassed, or believe that pain or low libido is just part of getting older. It's not. Silence never heals. Curiosity does. And when you approach your body with curiosity instead of shame, everything begins to change. Your sexual health is not separate from general health. It is deeply interconnected with everything that keeps you alive and thriving: your heart, your mind, your hormones, your diet, and your sleep. For men, conditions like high blood pressure, diabetes, smoking, and obesity directly affect erectile strength and stamina. For women, stress, dehydration, hormonal fluctuations, or even certain medications can affect natural lubrication and desire. These are not random issues. They're reflections of how your body is coping. The more you nurture your overall health, the better your sexual and urological health becomes. One of the biggest misconceptions people have is that sexual health is about performance. It's not. It's about connection, comfort, and communication with your body and with your partner. Many men tie their sense of worth to their ability to perform, while many women measure their health by how much pleasure they can give or receive. But sexual response isn't mechanical, it's emotional, psychological, and chemical. For women, desire often starts in the mind with emotional security, relaxation, and trust. For men, anxiety, stress, and performance pressure are among the biggest barriers to intimacy. You can't connect when you're tense or afraid of failing. You can't feel pleasure when your body is in fight or flight mode. Real intimacy begins when pressure ends. I often tell my patients, instead of asking, "What's wrong with me?" ask, "What's my body trying to tell me?" Because your body never betrays you, it protects you. Stress, fatigue, low libido, discomfort, these are protective responses. They're your body's way of saying, "I'm overwhelmed." Slow down, listen. When you start to respond to those messages with care instead of frustration, you begin to heal. Hormones play a crucial role in both sexual and urological health. They are the invisible messengers that shape everything from your mood to your energy to your physical comfort. Testosterone, estrogen, and progesterone influence desire, muscle tone, mood, and bladder control. When they fluctuate through stress, aging, pregnancy, or menopause, your body feels it. For men, low testosterone can lead to fatigue, loss of motivation, and a decline in libido. For women, a drop in estrogen can cause vaginal dryness, discomfort, or urinary urgency. These are natural changes, but they don't have to control your life. Supporting hormonal health doesn't always require medication. It often starts with the basic sleep, movement, nutrition, and mental wellness. Sleep is one of the most underrated forms of hormonal therapy. During deep rest, your body restores testosterone, balances cortisol, and regulates estrogen and progesterone. Without quality sleep, your hormones can't stabilize. Exercise, too, is powerful. Movement increases blood flow, boosts endorphins and supports healthy hormone levels. Even a 20-minute walk each day can improve circulation to your pelvic region, strengthen your core, and reduce stress. Chortra nutrition is another cornerstone. Food isn't just fuel, it's information for your cells. Diets rich in whole foods, lean proteins, omega-3 fatty acids, and antioxidants support your body's natural repair processes. Processed foods, excess sugar, alcohol, and trans fats, on the other hand, increase inflammation and decrease blood flow, two of the biggest enemies of sexual health. For both men and women, hydration is also key. Your bladder, your skin, your organs, and your sexual tissues all depend on water to function smoothly. Something as simple as drinking enough water can improve comfort and energy more than most people realize. I also want to talk about pelvic health, something both men and women overlook until something goes wrong. Your pelvic floor is the foundation of your urinary and sexual systems. These muscles control urination, support your organs, and play a key role in pleasure and function. But just like any other muscle, they can weaken or tighten over time. For women, childbirth, menopause, or sedentary habits can weaken the pelvic floor, leading to leaks or discomfort. For men, prolonged sitting, poor posture, or lack of awareness can lead to weak muscles that affect bladder control and even erectile function. The great news is you can train these muscles. Simple pelvic floor exercises, breathing techniques, and mindful awareness can make a remarkable difference. But balance is key. Sometimes the problem isn't weakness, but tightness. Overactive muscles can cause pain, urgency, or difficulty with release. Learning to relax, breathe deeply, and let go of tension can be just as healing as strengthening. Your body doesn't always need you to do more. Sometimes it needs you to soften. Let's shift to urinary health. It's something people rarely talk about, yet it affects millions daily. Your bladder is a brilliant organ that thrives on routine and care. Holding urine for too long, drinking too much caffeine, or constantly ignoring your body's signals can strain it. Women are more prone to urinary tract infections because of anatomy, while men may experience prostate enlargement that affects flow and frequency. Both deserve attention, not embarrassment. If you notice changes, burning, urgency, or waking up too often at night, don't normalize it. See your doctor. Most urinary issues are highly treatable when addressed early. Mental and emotional well-being are equally essential. You cannot separate your mind from your body. Stress is one of the most powerful disruptors of sexual and urinary health. When you're under chronic stress, your body produces cortisol, a hormone that suppresses testosterone, delays ovulation, and restricts blood flow. Your brain interprets stress as danger, which means it prioritizes survival, not pleasure. That's why people who are overworked, anxious, or emotionally distant often experience low libido or fatigue. Healing begins when you calm your nervous system. Deep breathing, mindfulness, journaling therapy, or even simple self-care rituals can lower cortisol and restore your body's natural rhythm. Let's normalize another truth. Changes in sexual function are a natural part of life. Bodies evolve, hormones shift, energy levels change. That doesn't mean your sex life is over or your body is failing you. In fact, it can mean your body is inviting you to explore intimacy differently, with more communication, patience, and mindfulness. Many couples rediscover connection when they stop chasing performance and start focusing on presence. Ask, what feels good now? Instead of, why isn't it like before? That shift turns frustration into exploration. Communication is at the heart of healthy sexuality. I've seen couples heal years of disconnection simply by learning to talk, really talk, about what they need and how they feel. Many people avoid discussing intimacy or urinary symptoms because they fear judgment or rejection. But vulnerability is not weakness, it's courage. When you share your truth with your partner, you invite them into your healing. If you're in a relationship, start gently. Say, I've noticed something feels different lately. Can we figure it out together? Or I like us to learn more about what makes both of us feel good. These small, brave moments open the door to trust and closeness. And if you're single, that conversation starts with yourself. Be honest about what you feel, what you need and how you treat your body. Are you ignoring your discomfort? Are you overworking, undersleeping, or running on empty? Your body mirrors your lifestyle. The more kindness you offer it, the better it functions. Chorcha movement is another form of medicine. Our modern lives keep us sitting for hours, hunched over screens, disconnecting us from the very core that supports our health. Movement increases circulation, supports the pelvic muscles, and reduces inflammation. You don't need intense workouts. Even gentle yoga, walking, or stretching can transform how you feel. Your body was designed to move. When it doesn't, stagnation sets in physically and emotionally. Torture, nutrition, and hydration deserve another mention because they are such simple yet powerful tools. Think of food as your body's building material. You can't build strength or restore balance with poor quality materials. Eat to support blood flow, hormone balance, and cellular repair. Incorporate foods rich in zinc, magnesium, vitamin D, and omega-3s, all crucial for sexual and urinary function. And don't forget water. Dehydration irritates the bladder and decreases energy. If you're someone who constantly feels fatigued or experiences mild discomfort, check your water intake before assuming something serious. Sometimes your body just needs the basics done well. There's also a deep emotional side to sexual and urological health that we don't talk about enough. Body image, self-esteem, and self-connection. Many people feel disconnected from their bodies after weight changes, pregnancy, illness, or simply aging. But confidence isn't about perfection. It's about connection. When you learn to appreciate what your body can do instead of criticizing how it looks, you rebuild the foundation for desire and comfort. Gratitude heals what judgment damages. If you're struggling right now, whether it's with pain, low desire, urinary issues, or hormonal imbalance, please hear me. You are not broken. You're human, and your body is incredibly resilient. It's capable of change, healing, and balance. The key is to listen early, act gently, and stay consistent. Start small. Prioritize rest. Nourish your body. Make appointments you've been avoiding. Every small act of self-care tells your body, I'm paying attention. And that's when healing begins. I've seen transformation in people of all ages, men in their 20s reclaiming confidence after years of anxiety, and women in their 60s rediscovering pleasure and comfort they thought was gone forever. In every story, the common thread was awareness. The moment they stopped feeling shame and started asking questions, their lives changed. Because awareness turns fear into empowerment. Remember, sexual and urological health aren't luxuries. They are vital signs of your quality of life. They affect how you move, how you connect, and how you feel in your own skin. Caring for them isn't selfish, it's self-respect. And the best part is it's never too late to start. Your body wants to heal. It's always working toward balance. You just have to give it the right environment. So today, take a moment to reflect. How are you treating your body? Are you listening to it? Are you giving it the rest, nourishment, and care it deserves? Because the truth is, your body is not your enemy. It's your greatest partner in life. When you care for it with patience and respect, it responds with strength, energy, and vitality. I want to leave you with this. Healing isn't about being perfect. It's about being patient. Don't compare your progress to anyone else's. Your body's story is unique. Be gentle with yourself and celebrate every small victory. Even noticing how you feel today is a form of progress. Thank you for sharing this space with me. I hope this talk reminded you that you are capable of change, that your health is in your hands, and that your body deserves your love and attention. Whether you start by drinking more water, taking that short walk, or booking that long overdue appointment, know that every step counts. I'm Dr. Rena Malik, and I want to thank you for caring enough to listen, learn, and take action for your well-being. Remember, your body is always speaking to you. Listen with kindness. Wishing you strength, balance, and peace on your journey forward.